Hello, my name is Dr. J. Michael Bennett with the Fondren Orthopedic Group. I am a sports medicine specialist who focuses primarily on dealing with pathologies of the shoulder, elbow, and knee. I am fellowship trained and CAQ certified in sports medicine as well as general orthopedic surgery. Now, many times if you injure your shoulder, you may be told you have a shoulder separation. Well, what does that mean? I think that this depends on what joint is actually involved. A shoulder dislocation is what we talked about, when there's a detachment or sliding out from the ball and socket mechanism. A shoulder separation, or also known as an acromioclavicular joint separation, or AC joint separation, is when these two bones up top, which is the acromion, which is this L-shaped bone, it comes out, you can feel it actually on your own shoulder. It comes out on the side of your shoulder. You feel this corner back here, and everyone's shoulder back here is very prominent, and it comes across like an L shape. It meets your clavicle bone, which is your collarbone here. These two bones meet each other right above the glenohumeral joint, or the shoulder joint. This joint is actually commonly injured in patients that fall down with their arm at their side and land directly on their shoulder. This is a very common football injury, and they get an AC joint separation, where these two bones end up either spraining the ligament between them or dislocating, where this collarbone actually sticks up. Okay? When that occurs, this is what it looks like with all the ligaments in place. This here is your collarbone coming up, and this is that L-shaped bone coming right here. These are all the ligaments that stabilize those two bones. So you have a ligament here between the two bones, the acromion and the clavicle, and you have ligaments here going down to this coracoid bone here, stabilizing that collarbone. So when that pops up or dislocates, it depends on how displaced that collarbone is from this bone. Oftentimes it's very minimally displaced and it's just very sore. If that's the case, you'll have some swelling there. Many times it's treated with conservative measures such as with a sling, ice, and rest, and letting things calm down before getting back to full activities. That's more of a sprain of this ligament. If you have a bigger sprain or a tear of this ligament, you'll see a little bit of a rise in it, but not a complete instability. That's usually seen as the grade 2 sprain, and that's also treated with conservative measures such as ice and maybe a sling for a few weeks and letting things heal up. Now, when it starts getting tricky is when you have involvement of all three ligaments here. So you have a tear here, and a tear here, and a tear here. And if you have a displacement, that's considered a grade 3 dislocation or AC joint separation. And this is actually where it's controversial, whether or not surgery is indicated or conservative measures. There's two schools of thought out there. Most of the time I will go ahead and base that on the patient's activity level and their expectations. If it's a very active person that wants to get back to high contact or full contact sports and activities, and they have an unstable shoulder in this area, oftentimes we'll give them the option of surgery to reconstruct this area and stabilize that joint. If it's a person that doesn't do a lot of activities, that's okay having a little bump at their AC joint here, many times you can put this in a sling and let it rest and let them heal up. And these ligaments will scar down, but they'll scar down in a different position, and this bone will be raised up a little bit higher than the other side. So you will have that sense of asymmetry there in your shoulders, but it will heal and it will stabilize. Now, when you go into grade 4, 5, and 6, that all depends on where this clavicle bone is in relationship to this acromion. If you have it significantly displaced, where it's obviously popping up, and it becomes a big problem in a sense that now you have an unstable AC joint, so the shoulder itself feels like there's no support in the shoulder. So it loses a lot of its stability. So the muscles around the shoulder start to get fatigued by holding the glenohumeral joint in position, because these ligaments here that attach this acromion to the collarbone, which attaches to the sternum, is now disrupted. So when you have a disruption as severe as a grade 4, 5, and 6, then oftentimes we recommend surgery to give them that stability, because this will cause weakness in the shoulder joint, will cause pain. Sometimes it will even cause numbness and tingling down the arm, because the nerve plexus or the neurovascular bundle comes actually through here, underneath here, and actually can become irritated or strained when you have any kind of instability between these two structures. But it has to be pretty severe and significant. That is called the acromioclavicular joint instability or separation. So it's important when you're discussing these things with your orthopedic surgeon that you understand the difference between a shoulder dislocation, an AC joint sprain, an AC joint separation, or an AC joint instability. And you need to be very clear on what your options are, and you always have the option of non-operative management since this is an elective procedure, but you also need to understand what the long-term prognosis is with those options. So if you have any questions or comments, please feel free to visit my website, www.jmichaelbennett.com, or feel free to call my office at 281-633-8600. Thank you.